Well, we're here with Dr. Chatterley today again. Dr. Chatterley from Casselberry, Florida, and a dentist. Hi, Dr. Chatterley. How is life over there in Florida?
Sunny and warm.
Good, like here in California. Well, Dr. Chatterley, I want to talk to you about there's a controversy out there. There's actually some rumor out there that people who wear denture and use lots of adhesive, denture cream, as it's called also, that those denture creams have a fair amount of zinc in it. And while zinc is good for the body, since it's at the gateway of the mouth, too much of it holding up those dentures, gluing them in it, which is in itself a very uncomfortable thing from what we know, they get zinc poisoning and they get nerve damage. Apparently quite some severe cases out there, even though it's not 100% proven. What do you have to say about that? Give us some, feedback, some solutions and things like that.
Well, for years, for decades, let's say, adhesive was a great help because there wasn't an alternative choice for people. The curse of dentistry, like I tell patients, is the lower denture. It's the exception where that works out well for a patient, the lower denture, and then as time goes by, the ridge recedes, the lower denture, it floats like a canoe when it's new, and then when the ridge recedes, they need something to help hold it into place, and most patients in the past have ended up trying to get better function with adhesives, and so it's served its purpose. Unfortunately, it's come to light that may not be in their best interest. However, implant retained dentures, the implants have had tremendous research and have become much more widespread. So there's a lot of results that have been tabulated, and implant-supported dentures are very predictable and really lock into place. It gives an attachment to the bony substructure, and the denture snaps down, pops into place. So really, the use of adhesives is going to go by the wayside. Fortunately, they're causing the neurological problems that evolves from the zinc poisoning, and anybody that may be sensing that ought to go to a neurologist and have that checked if they have some tingling in the extremities and the various symptoms. They would want to get that treated sooner instead of later. But definitely they'd want to also consider the choice of having the simple small implants. Two small implants placed can make a world of difference on the retention and the function of the denture.
Okay. So basically what you're saying, Dr. Chatterley, is first of all, if people think they have tingling in their fingers or in their toes, and they have numbness in their finger and their toes, weakness of muscles, jerking, things going on, they should go to an MD, maybe to a neurologist, but maybe first check in with the family doctor and see what he can do, and etc. And to make sure to eliminate that something like that is happening. Especially, they should do that anyway, right? Whether they wear denture cream or not, if this type of thing is happening, a nerve damage could be on the way, and if a nerve damage is caught early enough, it actually can be repaired. It's just if nerves, like everything else in life, I guess, if it gets beyond a make-break point, all of a sudden, well, that's it, they're gone, and they cannot be repaired anymore. So people should do that anyway if they have numbness, tingling, weakness in their muscles or in their nerves, in their fingers, in their extremities. So they do that, they eliminate it, and if they do wear denture cream, that usually means they can fix that rather. They should stop it, even though it is not 100% proven that that's what it is, but they should stop it because evidence seems to be pointing towards it a little bit, and they should stop it, and they should. The only way they can really stop it is, or make sure that it never happens in the first place, even if the denture fit okay now today, is to go to a dentist and get implant supported dentist, which sometimes works with the old dentures, sometimes new dentures might need it, but you put a couple, 2-3 implants in the mouth, which is a lot cheaper than all implants, and yet your denture now fits good. I've heard, and tell me whether that's true, an implant-supported denture is a world of difference to a normal one, even if the normal one fits well. Like it's new and it fits well. If you have an implant-supported denture, apparently it's just a world of difference. You can taste your food because you don't have this plastic or metal plate on